Hi, I'm Dr. Burgess, and I'm excited to tell you about a service that we've been offering here at Desert Hills Dental Care for years. We use the best technology to offer tongue and lip tie releases to patients of all ages, including newborns. I don't think I fully understood the significance of this treatment until I became a mom. Tongue and lip ties can create a wide variety of issues for our patients, including periodontal issues with speech, with eating, with teeth position and crowding, and with breastfeeding. I became more passionate about these services called frenectomies or frenectomies when I became a mom. And my peers were struggling with finding solutions for their kids who were struggling with speech and language issues or with breastfeeding. And I wanted to find out a way that I could help my friends.
I'm Shimbra, and I just wanted to share a testimonial about my son's tongue tie. I've been a patient at Desert Hills Dental for 7 years. Dr. Burgess takes care of me. She does awesome. I love her. I feel comfortable when I come in here. When he was 2 weeks old at his 2-week checkup, our pediatrician noticed that my son had a tongue tie, and we had actually been struggling breastfeeding, which I have 3 kids, and with my other 2, I didn't have that same problem. So I knew something was wrong, but I couldn't quite put my finger on it. Our pediatrician immediately said, "Ooh, we got to get that fixed." But of course, getting that fixed meant a procedure. So I was super nervous, hesitant. I had fear, and I was like, no, let's just see what can happen. Let's just see how the week goes on. And it only got worse. And I decided to call. I was super fortunate that Dr. Burgess does that treatment here in office. They do the laser where they actually remove the tie from my son's tongue tie. So
he was what, 2-3 days old, and first of all, I was just really excited because I got to see him and to meet him. But then when I saw the tears in Shimbra's eyes and could just feel and understand her stress about the pain she was experiencing and the worry that she had over her son. He was smiling now. It was just really nice to be able to affirm her worries and offer a solution for them. So
actually, I wanted to cancel the appointment. I was so nervous. I was like, I don't want him to have a procedure. I don't want him to be in pain. Before they scheduled and were like, oh yes, we're just gonna do it, she said, just bring him in. Let's look at it and I can give you my best advice and we can go from there. So when I brought him in, we got him out, they looked at him and they assessed it, and she said, I think you would really benefit from it, but the choice is up to you. And I valued that and I appreciated that. As his mom, I wanted to protect him, and she honored that. We held him, my husband and I held him, and she did the laser treatment. It happened super fast. It was a smooth process, and he cried for maybe a second, but after it was over, he latched so good that I immediately had relief, and you could tell he did too. And for the first time, I actually got to see my son stick his tongue out. So like after that, for days, every time he stuck his tongue out, we thought it was the most cutest and sweetest thing. But yeah, the healing process was super easy, super great, and I couldn't recommend Dr. Burgess or Desert Hills Dental more.
Tongue and lip tie releases aren't just a simple fix. With a team of people like primary care providers and speech and language pathologists and lactation consultants and myofunctional therapists, we can make a big difference in these patients' lives. You know, I'm a dentist, but first of all, I'm a mom and I have a family, and I really look forward to meeting your children and your family and helping you decide if this is something that could help you.